Okay, shall we get started?
Yeah.
Yes?
Yeah.
Okay, hello everyone and welcome. I trust that you are all healthy and safe. I am Rita Chua-Magnus, the Director of Industry Relations and Communications for the American Academy of Facial Plastic and Reconstructive Surgery. Thank you so much for joining us tonight. This is the second of a series of webinars called Face Value, which is brought to you by the AAFPRS. Before we get started, I'd like to thank Rohrer Aesthetics, specifically Mike and Mark, for their sponsorship and support of this virtual event. I would also like to acknowledge the assistance of Bell Media for handling the logistics and technical aspects of this particular webinar. Now I'd like to introduce our guest speaker, who will outline and describe the many benefits of Pixel 8 RF microneedling system. Dr. Randolph Waldman is a prominent facial plastic surgeon from the Great South and practices in Lexington, Kentucky. Dr. Waldman is an active member of the AAFPRS and has been a member for over 30 years. He has served on the board of directors as a Southern Region Director and as Vice President of Public Affairs. Dr. Waldman is also currently on the board of directors of the American Board of Facial Plastic and Reconstructive Surgery. He has organized and coordinated over 45 major medical meetings and has given over 500 presentations at cosmetic surgery meetings in the United States and Europe over the course of 25 years. So without further ado, Dr. Waldman, you can take over and let's get this program started.
All right. Thanks so much, Rita, for that fabulous introduction. I'm honored to be introduced by someone that has been around the Academy almost as long as I have, so we go back a long way. I'd also like to give a shout out to Rohrer Aesthetics and to Mark Rohrer. He's been a long time friend and really colleague, but he's been a great supporter of facial plastic surgery and aesthetic surgery over a number of years. So I'd like to also acknowledge the Academy for sponsoring the series. I think it's very timely, and as I understand it, this is a continuing series. We're going to be, I guess, the second part in that series. This is the unit that we actually use, and this again is from Rohrer. It's really a fractional microneedle radial frequency device, and I'm going to talk about the similarities of microneedling as compared to CO2 fractional laser resurfacing, which is something else that we've done for a number of years in our practice, and we feel that's effective as well. The unit I have in my practice is one of Rohrer's units, and we can, some of you may want to ask some questions about that, but tonight's talk or tonight's webinar is really on microneedling. So I want to get into the heart of that, and I'm gonna start by playing a video that we made in our office. We have a video unit in our office, and we have someone that's kind of an expert at doing. Sorry, let's go back.
Not that one.
So that was just a little video that we produced, and we have it on our website if anybody wanted to see it. But we try to make these little 1-minute videos for pretty much everything we did. That had some good footage that we shot, and I wanted to show you what we can do with videos and advertising and marketing these types of procedures. But here's Madison with the patient, and you can see that we're actually holding up a nitrous unit that we sometimes will use to sedate our patients. But digging into what the unit's all about, in the upper part of your screen, you see a handpiece, and that's a 64 pin. We use the 64 pin needle unit most of the time with our handpiece because it covers more area. But there's a 64 pin, which means there's 64 little needles that will go into the skin. There's also the 25 and the 49 pin units that you can place on your handpiece, and that allows you to treat smaller areas, perhaps the upper lip or the lower lid region. But there's lots of different devices out there that offer this type of technology. And I'm gonna talk to you a little bit about how this differs versus basic microneedling. We were presented some technology at least 5-6 years ago for just microneedling, and we used it, and honestly, it was okay. We saw some, patients felt good about it, but it really didn't create changes that we could see photographically and document. And so it was more of a feel-good procedure. Perhaps it created a little bit of swelling. I'm not so sure about collagen formation, elastin formation, and so how is this different? Well, number one, there's no or minimal bleeding that you're going to see because of the thermal coagulation effect of radio frequency. Additionally, we're seeing some enhanced effects when you compare it to normal micro, as I said, and we're seeing, some evidence that we are getting collagen, stimulation. How does it work though? These are just some little diagrams, and you can see that we use these very tiny micro needles to deliver radio frequency energy into the deep layers of the skin. And really we're talking about the dermal layers where we see collagen elastin fibers that actually support the skin structure. And we believe, and studies have shown that this polarity of energy is creating arcs of energy between the little microneedles and around them, thus delivering energy inside the skin. So we've all become knowledgeable, and we've seen over the years radio frequency and other types of frequencies that are applied to the skin. What got my attention on this, and it started making sense to me, is now we were placing this frequency into the skin. And for the first time, some of this, it just made sense that we could heat up the collagen, we could heat up the elastin, and we can make changes that were actually under the skin rather than on the surface of the skin. So these are diagrammatic, and it shows the needles in the skin, and it shows when we turn the energy on. So the depth of microneedling is really determined by several different factors. Really the main factor which determines the depth of microneedling is the area of the body that we're treating. So this is, again, a diagram that shows the depth that we'll go to when we treat the face and the depth that we tend to go to when we're treating the body. As you can see on the face, we have a choice. We can go anywhere from perhaps 0.5 millimeters all the way down to 3.5 millimeters. We generally don't use the deeper settings, and I'll let Madison talk to you about this because she's the one that actually does the treatment, but we generally don't use these deeper settings on the face. Generally, we won't go any deeper on the face than probably 2.5 millimeters. And we're usually in the 2 to 2.5 millimeter range, as demonstrated by this particular slide. So what are the treatment areas? Well, we talked about the face. What are we looking to accomplish when we treat the face? Well, I think that we're on pretty good ground to say, a pretty safe ground to say that we're trying to treat fine wrinkle reduction. We're trying to tighten the skin, particularly the neck. We're going to try to just generally rejuvenate the skin and improve the dyschromia. And I'll talk a little bit about that in just a moment. We've seen some interesting results with pore reduction. This has always been something that is, we've really not had great treatments for, keeping the pores cleaned and doing hydrofacials and extractions and all those types of things have been done. We're actually seeing some pretty good results with pore reduction with this. And there are probably several different reasons for that. But here's the category that I think we've seen the most dramatic improvements, because heretofore, we would have to do a fully ablative CO2 laser resurfacing or dermabrasion to really see much of an effect on acne scarring. I was pretty shocked the first time that Madison brought me some pictures of people that she had been doing, because we were seeing some interesting results, perhaps even at a level that we would see after CO2 laser resurfacing. And with that, we started using it on traumatic scars as well, sort of like we would with CO2 laser resurfacing, where we'll start working on scars a couple of months after the scar is created, and then we might do 2 or 3 or even 4 treatments on that scar. Body treatments, again, the same thing, scars. I really don't have any experience with hyperhidrosis, and maybe at the end of this webinar, Mark can address that. We've done a little bit with stretch marks. It's still early in the process. We haven't done much with spider veins, but I'm going to show you a couple of pictures of skin tightening on the extremities, and we have some results there, and other people have as well. But for tonight, mostly we're going to focus on the face, because this is the American Academy of Facial Plastic Surgery webinar. So let's talk about some common questions that were asked. What are the parameters that we use? Maddie, you want to talk a little bit about the parameters that you most commonly use, and we'll leave this slide up.
Okay, so for the face area, parameters, depth, I'd say the most frequent, just depends on the treatment area. Forehead, you're looking at 0.5 to 1. Is that what you're talking as far as that goes?
Yeah,
my most common is what?
Yeah, what are you usually treating people at? What depth and what frequency? Let me make a point with the frequency too that I should bring out. A lot of units on the market, as I understand it, go to only 1 megahertz. This particular unit will go as high as 2, so that's an advantage. Madison, you can address that, but generally you're treating the 1 by 1 centimeter and using a 64 pin needle. Is that correct?
Yes, that's correct. And again, like you said, I'm usually going to specifically, if I'm working on acne scarring, to that 2.5 depths in those fatty tissue area of the cheek. But most specifically working around that 1.5 millimeter throughout a lot of the face.
And generally, the depth that you're working at is?
The 1.5 millimeter.
1.5, and you'll go to 2 or 2.5.
Yes, for acne scarring, any area that I feel like I'm working with, you've got more of that fatty tissue.
Okay, so let's go to the next slide. So people will ask me, how important are before and after pictures? Well, I think before and after pictures are crucial with really almost everything that we do. So we're really good about taking pictures before and after every single treatment. Generally, we'll do at least 3 of these treatments spaced about 3 to 4 weeks apart. And sometimes people say, yeah, I don't know if I see the difference. And then we pop up the picture, and lo and behold, that's really been an important element of using microneedling with radio frequency, and that the pictures do tell a story. Madison, your comment on that?
Yeah, I agree. I think a picture prior to every treatment, and then reviewing those photos with the patient so they can see as they're progressing and see changes with each session.
So it says, the next question that people ask is, what are your current indications? And we're expanding our indications all the time. We love it for crepiness of skin, particularly in the anterior neck. We really like it, as I mentioned, for acne scarring. But we found that it's really surprisingly effective for dyschromia of the face, neck, and very important, the décolleté, because we really haven't had any great treatments for the chest wall. Yes, we've had fractional laser resurfacing, but we found this to be advantageous. Now, I want everyone to think about these needles going into the skin. It's very important to understand that for the most part, we use non-insulated needles. And when you have insulated needles, the radio frequency charge is only applied after the needles are into the skin and into the dermis. But when you're using non-insulated needles, then the injury begins at the epidermis. So it sort of simulates, if you can imagine, fractional CO2 laser resurfacing, because that's what we're doing. We have all these little laser, we're fractionating the laser beam, we're fractionating the fully ablative laser. And so we're getting these penetrating spots laser. Well, the same thing happens with this. So this is sort of a combination of fractional CO2 laser resurfacing, when you're using the non-insulated needles, it's a combination of that and using radio frequency beneath the skin. So you're getting a little bit of the best of both worlds. That's why when you're using non-insulated needles, we're seeing very nice effects with the dyschromia of the décolleté and the face and the neck. Madison, you would agree with that?
I definitely agree with you. I would say that it does a great job of just cleaning up dyschromia for sure. And again, you talked about the chest, and I think this crepiness on the chest is consistently one of the things our patients come back, you know, thrilled with, is having that area tightened with, it's not been possible before.
And who does the procedure? Well, Madison does the procedure for us, and she's developed a lot of expertise with this procedure. She helps train, she's a trainer for Roar Aesthetics, and so I loan her out for some of the meetings. Some of you have seen her in exhibit halls. Does a really good job with this, has a great intellectual curiosity and scientific curiosity, and that's the type of person that you have to have do this, somebody that really takes this to heart, and she stays booked up. It's been a very successful procedure, and this just, we're showing a picture of a patient, a gal that works for us, Madison, who you're seeing right after completion of the procedure. This is what you can expect to see before we apply the ointments, right?
Yes, that's true. And I tell them really, really bright red for about 2 hours, and it will decrease significantly from what you see there in that photo after about 2 hours.
So let's go into that for just a second, because that's an important point. When we do fractional laser resurfacing, it's an interesting point. We do fractional laser resurfacing, Madison, and people have 4, 5, 6 days of downtime and some discomfort when we're doing it and after we do it a little bit. Would you agree?
Yes, I agree.
And yeah, with this procedure, we're seeing this redness and the obvious look of this go away within 12 hours. I'm not really sure why that occurs, because we're doing some of the same things, but it does occur. And most people, right after we do it, or within 12 hours after we do it, there's very little evidence that we did the procedure.
Yes.
So we go back to the question of, do we prefer non-insulated needles? Yes, and this is what I just mentioned. I was a little premature in the previous slide, but yes, we love non-insulated needles. In fact, we really don't use insulated needles because, at least for most of our patients, I'm trying to treat both the epidermis and the dermis. And for me, this has become a little bit of a combination of a deep radio frequency treatment and surface treatment with a fractional CO2 laser. And yet I'm not getting the downtime, and that's the thing that makes it work so well for us. Any comments on, have you used I don't think we've really had a whole lot of experience with the insulated needles.
I have not used insulated. I have not had a need to use insulated needles. With the Pixel 8, it's got that delay to help to protect the patient from getting the post-inflammatory hyperpigmentation. So there's not been a need for me to use it.
Yeah, and the thing is, they do have them. Mark offers that. But again, for the most people that have called our office or asked about it, I really like the effect of using the non-insulated needles. And I know other people may disagree with that, but that's how we do it. So here's a really important question. Do we sometimes use it with PRP? Yes, and some people really think it does something and others not as much, but we still use it and we charge extra for it. I know that, Madison, you feel that it does something. I'm not as sure about it as you are, but would you comment on PRP?
Yeah, so for me with PRP, the biggest, I see the biggest change with acne scarring. I think the more collagen production you can get with the treatment, I tell the patients it's not necessary, you're still gonna get a change. But when I'm looking at acne scarring, I like to throw everything at that I can to get the best result. And I do think you get a little more collagen production when you're using PRP with the treatment. I do inject the PRP. I apply it after the treatment topically, but then I also inject the PRP down into those deeper acne scars to really just give them the most benefit.
You know, another addendum to this, sometimes she'll bring the patient over to our clinic from the skin spa, and you know, we'll evaluate them. And once we do these microneedlings, we do maybe 3 or 4 of these on acne scarring, but between treatments, we're not afraid to inject one of the fillers into some of the deeper scars, because we know that injecting one of the HA fillers is also very effective on certain scars. That's just something that we've done for many years. What about substituting a cosmeceutical for PRP? I know that some of the time we apply Definage serum between the passes, and afterwards we're also using elastin as a maintenance agent on the skin following the procedure. Your thoughts on using the cosmeceuticals?
My thoughts, I have seen great results using both the Definage and the elastin. Traditionally, I've tried it different ways in application, but I'm encouraging all patients, it's that after treatment when they're at home, anything they can do to really continue to encourage that collagen production and those changes in their skin between treatments until I see them next, as well as retinol. I also encourage them to use retinol between treatments just to really keep that collagen production up.
So, you know, and I agree, and our patients happy. You know, yes, for the most part, you know, every procedure, all of the non-invasive procedures have their following and have people that, you know, a certain percentage of people that are ecstatic and a certain percentage that see the results and they're kind of happy. But at any rate, you know, we feel that probably among many of the procedures that we do, that this is one of the most satisfying procedures and has one of the best patient acceptances and happiness. Madison, your comment on that?
Yes, I agree. I think as far as patient satisfaction, this is one thing that consistently patients have come back and have been happy and have actually been surprised at the results that they've gotten. Again, it's chest, acne scarring obviously is a big thing. Just areas of crepiness that they've not ever, you know, they've thrown a lot of different treatments at and they've never had any success. So definitely high patient satisfaction. And with us being at 2 years now, we're also seeing patients coming back in for their, you know, maintenance treatments, which they're really good about. I like to see them at least every 6 months if I can, just to kind of evaluate. And then a lot of them a year out are coming back because they just want to keep up with what they've accomplished.
So how long does a single treatment take? Usually we apply topical anesthetic. We use a BLT preparation and we'll put that on 20 to 30 minutes prior to the procedure, sometimes a little bit longer than that. It generally takes 30 to 45 minutes depending on the number of areas we treat. That 30 to 45 minutes is probably 2 areas, face and neck. If we treat neck and neck, it'll probably take 30 to 45 minutes as well. If we're treating multiple areas, the whole thing with the topical and the procedure may be an hour. Is it painful? Well, we use it with nitrous at times. We may use some Valium pre-op. Of course, they have to have a driver for that. But we really like the chiller, the Arctic Air chiller that is also that Roar supplies. That's probably been the biggest help with doing our procedure as well as the topical anesthetic. How long does it take to recover? We already talked about the erythema. It may last for several hours, but it fades by the following day. And the great thing is makeup can usually be applied the next day. Madison, I know pain is one of the things that you dealt with at the very beginning. And I think, you know, we've learned how to do these procedures, and these needles that we're using when we go up to 2.5 millimeters can be uncomfortable. Comment on discomfort.
Yeah, so discomfort, I'd say adding the chiller was the biggest change. We started with prior to the chiller. The patient can hold that and blow it. The biggest discomfort with this is actually the heat from the radio frequency. So being able to apply that chiller to those areas that you're treating is very, very valuable.
Okay.
Yeah.
So number of treatments, we use a minimum of 3 treatments. We charge with a package of 3 usually. We incentivize them for that package, and it's a little less expensive than doing separate treatments. And then we usually recommend a follow-up treatment every 6 months. And as she said, we're we're now on this for 2 years, and we're seeing people coming back and for a little additional treatment or tightening. So it's been very effective when we charge that way. And here's Madison doing the treatment. Again, I'm going to show just a couple of 15-second videos. And we'll show it on the other side too. Makes a little snapping noise. But you see it's tolerable. Now this patient's using nitrous, but a lot of our patients don't, and she's not showing the chiller on this, but I feel like the chiller probably works just as well as the nitrous.
Yes.
And this is what a patient looks like when we're done. I think you've applied the Definage serum to her face at this point. Again, what we'll usually do is do 2 passes, and if we're going to use PRP, we apply it to the tissue, to the face between the passes. You also do use Definage serum in this fashion, Madison?
The Definage I've been applying after the treatment. Yeah, so PRP.
After the second pass.
Yeah, after the passes.
So
and
here
this
we are
actual specific. Go ahead. I'm sorry.
Well, here we are. We're completely done with the procedure at this point, and you've applied the Definage serum to her face. So that's that glistening look that you see.
Mm-hmm. Yeah,
So
the little, now I'll wipe. Yeah, go ahead.
Let's show some pictures, because that's really what we want to spend our time showing you, indications and the type of things that can be accomplished. We can get into the details of this, and if you get interested in this, Madison is always happy to field phone calls. We get a lot of phone calls to our office about some of the details and the techniques that we use. But this is an acne scarring patient, 49 years old. This is after 2 treatments. I think she's probably had a 3rd treatment, but this was after 2. You see a little erythema there, but we're starting to see the effect on deep pores and porous acne scarring. And we'll show you a couple of views here. This is a side view. This is the type of result that I would have expected to have gotten perhaps with old-fashioned dermabrasion when I first started. And of course, we adopted totally ablative CO2 laser resurfacing in the mid-90s. And these are the types of results that I would get with that. But, with laser resurfacing, there's 7 to 10, 12 days downtime, and there's potential risk. And with this procedure, while we have to do it, 3 times, 2 or 3, or even 4 times, there's not that downtime. So this becomes more of a less invasive or even non-invasive procedure. Here we are a little closer, and you can see the effect there. And another side view on this patient. So, this was one of the early patients that actually Madison brought over to show me the pictures of. She'll do these patients, she'll get them all the way through the cycle, and then she'll sit down with me and we'll study pictures to see how we're doing with this procedure. We'll talk about settings. We'll talk about patient selection, lots of different things. And this is when I started really getting excited about, microneedling with radio frequency, because now, unlike some of the less invasive things, there was clear photographic evidence that something was happening. And how far could we push the envelope? Could we keep pushing it and make even more changes? This is another acne scarring patient, and you can see the sequence of events. And this is a young girl, and Madison, talk about the patient, because they had tried a lot of things with her, and I think she'd even been on Accutane at one time. And this is a younger girl.
Mm-hmm.
Can you see her pictures up there?
Yeah, she had been on Accutane previously. Yeah.
So you see the difference. Obviously, the pictures on your right show. How many had you done on her?
So with these photos, we've done 2 treatments. 2 treatments.
So, we're going to go, and we'll push the envelope further. We'll do 3 or 4 or even 5 treatments on acne scarring patients if they'll tolerate it and if they continue coming back for follow-up. But with this type of improvement, they really will, because acne scarring patients have been patients that have been, been told they can't have much, they can't get much done. People have talked about fully ablative CO2. It's scary to a lot of people. This is just another patient, very similar. This patient was actually This is after 3 treatments. She had acne scarring, but she made some of these scars herself. She was her own worst enemy with acne scarring. And again, you can see both the pigmentary change, and you can see the effect on pore size, skin texture, and acne scarring.
Yeah, she had melasma, which is one of the things that I think we were, really impressed with that.
Yeah, and you can kind of see the melasma that she had there. So that's an important observation. You're absolutely right. So again, now we're getting the combination of creating or improving scars, and we're also improving skin texture, and we're also improving coloration. So now we come to the next patient. This again was an earlier patient, and we did her, and the thing surprised about when we looked at these pictures was the dyschromia and how much we had in dyschromia. We'll show a couple of other pictures on her, but this is actually, isn't this one of your aunts that we did early on? I think it is.
Yes, yes, it is.
And she was thrilled with these results just to this point. 63 years old. And here you see her from the front. And you can see the amount of dyschromia and the amount of improvement. But take a look at her anterior neck. Now we're seeing after 3 treatments, we're starting to see some tightening of the front of her neck and that crepey skin that she had. So much sun damage that she had had. And yes, there were some other, a facelift would be good, but she wasn't interested in that. And yes, fractional laser resurfacing would be good, but that would involve downtime. And here we've got a procedure that's going to start tightening up the skin of the neck, and it's going to improve a lot of the dyschromia. Maddie, any comment on her?
No, I'd say she was probably one of the first ones that we did see the changes in dyschromia. And for her specifically, she had said, there's this spot in my forehead. I didn't have this before. And we went and looked back at her photos, and it's, you couldn't see that spot because you had all that other pigment. So she was thrilled to see that those changes have been made. And that's, again, just showing what photos before and afters will show to the patient. That was there before, but these positive changes is what made, that obvious.
Consistent photography is really important. And then we started, kind of saying, well, let's compare split screen slides. And this is a split screen on her, which is easier for me to see. Now take a look at the anterior neck and look at the crepey skin on the right side of your screen versus the left side. And you start seeing these changes, and the dyschromia really shows up in this picture. So I like these split screens. This is Madison's idea, and split screens. It's another patient, kind of a similar sort of thing, treating crepey skin and treating dyschromia. And again, we're headed in the right direction. 69 years old, non-invasive treatment, no downtime, and very nicely done. And then a tightening of the neck. And here you can see, it's not a facelift again, but it's certainly, and it's not, it's not a fully ablative CO2 laser, but it's not invasive. It doesn't have the downtime, and it's pretty quick, and it's relatively inexpensive compared to those procedures as well. And the greatest thing is I'm not doing it. So I have somebody else doing it. So again, this is dyschromia. Just another screen. I put this patient in because I liked it on the anterior neck, but I also like to look at her skin texture and pore size. And that's when we, on all these people, we started looking at pore size, skin texture, and you can push the envelope as far as you want. You can keep doing these procedures. We have a lot of patients that come back for more than 3 procedures, and then we start pricing it by the procedure, but very effective. This is one of our, we did her a little later.
Yeah,
this particular patient.
I'll add to that one.
The one previously? You want to add to this one?
Are you talking to me? Yeah, the previous patient. Yeah, because I get a lot of questions from people about this rosacea. This patient specifically had rosacea, and we get really good results with treating patients with rosacea. It's not a contraindication with the microneedling radio frequency, and we actually see improvements in their rosacea following the treatments.
As opposed to CO2 laser resurfacing, which we think actually in some patients aggravates rosacea. So now we come to a patient that's one of my favorite patients. I never could get her to quit smoking so that I could do a facelift. And that's really what I wanted to do. And, you know, interesting enough, after Maddie did these procedures, she decided to quit smoking, and, you know, and which is great. But she's 56 years old, and start looking at her neck again and the amount of improvement. Once I saw this particular patient, this is the one that pushed me over the edge to really become an advocate of this procedure. It had to be proven to me. I'm a skeptic, and it had to be proven to me. And when I looked at her neck, there was no question, looking at her pictures and looking at her in person, that we had done something here, that it had some effect here. And you can look at the corners of her mouth, you can look at skin texture, but particularly the anterior part of her neck was very impressive. It's another patient. Again, lots of different things happening with this patient, but this patient was actually, you're seeing a pre and post-op facelift patient. And the reason I put her up there is that we did 2 or 3 microneedlings before I did the facelift. And it helped with the dyschromia, and which was very important. I know there are some people that do facelifts and CO2 lasers at the same time. I choose not to do that. I don't want to complicate my facelifts any more than they're already complicated. And so now we're actually doing microneedling, 1 or 2 treatments before we do facelifts, and then we'll come back and continue our microneedling cycles after the facelift. Maddie, comment on this particular patient, under the eyes particularly.
Yeah, so this particular patient, yeah, under the eyes, we see great results with under the eyes. Skin texture, so you can pull the skin, but you can't change the way the skin looks and feels. And so when you clean that slate, take them to the OR, and then afterwards do that final treatment, just to really clean up the whole picture, the results and the changes are, you know, unbelievable.
And this patient did not have a blepharoplasty. So that's what we're trying to show you here, is the effect that we can get underneath the lids. But I love to do 1 or 2 treatments on patients, Maddie, to condition their skin and change the coloration before I do facelifts. And so we've developed that as a protocol on anybody that we can get to do that. It's the rare patient that I don't try to send them over to Madison first. Now, décolleté. This is another patient, and you can see both. We did her neck and décolleté, and you really see that area at the top of the cleavage that she has. You know, we felt like this was just an incredible result on that crepey skin. And there's so many women that will come in and complain about this. And so doing the neck and décolleté is something that we very commonly do. Sometimes we'll do the neck, face, and décolleté in 1 treatment, but more commonly do we do the face and neck or the neck and décolleté. And you can see at the top part of the cleavage area the degree of improvement, but you can also see the crepiness of her neck and how much that's improved.
Mm-hmm. Yeah, overall texture throughout the whole chest for sure.
And pigmentation.
And pigmentation.
Another patient. You know, primarily dyschromia, lots of dyschromia, real sun goddess, and also tightening of her neck. And we, you know, we feel like that this, the tightening of the skin of the face also became very apparent, particularly just lateral to the lips, to the nasolabial furrows, and the coloration of this particular patient, as well as skin texture. There's another patient.
Yep. Refreshing.
Yeah, just a refreshing thing. It's, again, not a substitute for a facelift. This is somebody that wasn't interested in a facelift. Oh, just, you know, didn't want to have any surgery. This is the non-invasive thing. Notice the neck, notice the bottom of the neck, particularly, you know, just above the sternal notch, and how much the skin is tightened up in that area. Even facelifts really don't do a great job of tightening skin in that area. Notice the décolleté on this particular patient and how we've resolved some of the crepiness. Not all of it, but some of it. Now, this is a patient that that Mark Rohr sent me, and this is not one of our patients, but again, nice result from someone else, just to show it can be done, not just by Madison in our office, but other offices have replicated the stuff that we're doing, and you can see the amount of tightening for this particular doctor. And now this is another patient from another practice, because we really haven't had the experience on the extremities, but this was sent to us by Mark Rohr. This is an undoctored picture, And you can see real problem, crepiness on the upper legs. And, you know, after I think 2 or 3 treatments, this is the type of thing. So these are the ways you can push the envelope yourself. This is, again, the patient at the end of the treatment. Now, Maddie, talk about our post-treatment regimen.
Yeah, so just specifically, I tell all patients, you know, just use a gentle face wash, something that doesn't have any additives in it. There's not a whole lot. You're really looking at that, you know, 48 to 72 hours of just being careful with your skin. After that 72 hours, they're back to making sure they're wearing their sunblock and getting kind of back into their regular skin regimen. I specifically in our office, we use Definage and Elastin, both as our actives, as our peptides. And then CE Acrylic, I'll also encourage them to use, again, just to protect that skin after their treatments.
We use SkinCeuticals as well, but you know, so much of this is important for your patient to have a relationship with the people that do your skincare and to give them advice. And you know, I send them over there and they take over at that point, and I get them back at some point. But it's just amazing what you can do for patients and how good you can make them feel about their skin. So anyway, we also like to use Elastin's products, the particularly restorative skin complex.
Yep.
There's another patient, and I show her because she's a great patient, and this is a combination of microneedling and a facelift in our practice. One or two more patients that I'm showing for a reason. So you can combine it with facelifting, but you can also combine it with scar revision. And this is an Asian lady that complained about the erythema and slightly elevated appearance of the scar in the mid portion of her neck. Here we've done a couple of treatments, and you can see that the scar is beginning to fade. So we really don't have any reluctance using microneedling, Maddie, on Fitzpatrick skin type 3, 4, maybe even up to 5. You agree?
Yes, I agree. I haven't had any issues. I did initially, in the beginning, when you're treating those higher Fitzpatricks, did test spots and had not had any issues with any hyperpigmentation coming back.
So I just, I'm going to turn this over to Mark Rohr in just a second. And we're honored to have Mark on this webinar. But I want to remind everyone viewing that the American Academy of Facial Plastic Surgery has a meeting. It's always a great meeting. It's in Boston this year. It's a fun to September 10th through 12th. The information for this can be, gained from the Academy website. Also, this webinar, I think, is being recorded, and it'll be available in a few days on both Mark Rohr, the Rohr Aesthetics website, and also on the American Academy of Facial Plastic Surgery website. I'd like to put in a plug for my own meeting, Global Aesthetics, which is coming up in November 5th through 8th this year at the Lowe's Hotel in Miami Beach. It's a great multi-specialty meeting, and we talk a lot about things like radio frequency microneedling, and we talk about a whole lot of other things. And so with that in mind, I'm going to appreciate your attention. This is my email address at the bottom of that. If you want to write to me at srwaldman@AOL. Yes, I'm still old-fashioned and have AOL. I probably always will. So, but anybody that has any questions, feel free to use that email address. I guess, Mark, we can open it to questions, or let you go ahead. And you want to speak next, or you want to open it to questions?
You know what, Dr. Waldman, why don't we open it to some questions, and if they have some direct questions they can ask you right now, it'd be great.
We'll take any questions if they don't relate to Alabama football. Go ahead. Chuck, any questions out there for us?
Yeah, there were some questions, but I think Mark answered most of them as we went through. If anybody's got any other questions, just feel free to raise your hand or submit it through the chat. We'll open it up for Dr. Waldman. But Mark was fast and furious answering questions as you were talking. There was a lot of engagement.
Mark was fielding the questions. Well, that's
Yeah.
good.
So we do have a question. So compared to pro-fractional YAG laser, any texture?
Mark, you better handle that because I don't have a pro-fractional YAG laser, so I wouldn't know because I've never used one.
Yeah, and I'm assuming that they're probably talking about erbium YAG because I'm not sure about a pro-fractional YAG either.
Maybe they're talking about an erbium YAG. Yeah, I think so.
Yeah, that's correct.
We've got a question. What depth do you use in the neck area?
Madison?
Okay. Yeah, I can do that. I was going to say, let me know whenever you guys want to answer the other question. On the neck, through the jowl area, I'm using 1.5 to 2 in my depth. And then usually through the full neck, the neck will actually tolerate about 2.5 millimeters of depth throughout most of that area. Down in the submental area, I'm usually going about 2.5. If the patient's skin will tolerate it there.
Awesome.
I'm seeing lots of questions popping up there.
Yeah, so do you find the higher power setting of 8 or 9 more effective than 6 or 7?
So I personally, I feel like passes with the 6 and 7 power levels, with 2 to 3 passes in an area, 3 passes sometimes if I'm treating an area that I'm really feel like has a lot of laxity, 2 passes in areas that I feel like maybe it's not as necessary. That's what I personally like to do. I think somebody asked, I've never had a burn. I saw that earlier too with the microneedling. I've never had any in our office, and I've done hundreds and hundreds of these. I've never had anything that I would consider like an adverse reaction, something that I would, has made me feel uncomfortable.
The great thing about it is that really is the great thing about it. It's just we haven't seen issues and problems that you would think with getting this level of results. Even a lot of the non-invasive technologies that are out there, occasionally you can get some type of problem, but we haven't seen that. So I'm knock on wood, I hope we don't. But at this point, we just haven't.
All right, Chuck, we're starting to run out of time, so let's get started with my slides. And first thing I'd like to do is, and y'all can call our office or email Dr. Waldman. We'll be more than happy to answer any questions you have. But first of all, I want to thank Dr. Waldman. Thank you for the presentation. Rita, thank you for providing Roar Aesthetics the opportunity to present tonight. And thank y'all for joining the webinar for tonight. I'm going to go quick, but as many of you are aware, in 2000, I started my own company, Sandstone Medical. Sandstone sold affordable lasers. Our lasers were priced at $40,000 and below. And from 2000 to 2012, Sandstone grew into a multi-million-dollar company. We sold Elman Cynosure in 2012, and I worked for those guys for 2 years, and then I had a 1-year non-compete. So fast forward 2015, I started Roar Aesthetics. Just to give you a quick background to let you know that I've had my own company. I've been in this industry for about 20 years. And I'm proud to let everyone know that Roar Aesthetics was a healthy company pre-COVID-19, and we're still healthy today. Since the shelter in place, we've not had to lay off any of our employees. We've not furloughed any of our employees. We've not cut their pay. It's been business as usual for us. And the aesthetic community, especially the AFPRS members, has been very good to me and my family. So at this point in time, the way I'm looking at this industry, it's not about Roar Aesthetics and growing my business. I'm considering and trying to think of how I can help out the doctors who helped me to get to where I am today, how I can help and give back. So I've thought about, what's going on in the landscape of this industry, and I understand that there's many practices that are going to be struggling due to the coronavirus pandemic. I also get that cash flow is going to be an issue for a lot of your practices. In addition, I think that pricing for patients for the procedures is you're probably going to have to adjust that, and it's probably going to go down so that they can be able to afford elective procedures, because they're just like you. They haven't been working and they don't have the disposable income they had 2 months ago. So therefore, over the past several weeks, the Roar Aesthetics team has brainstormed, and we've developed a couple programs, and of course it's based on credit approval, but we think we have some programs that'll help your practice obtain cutting edge technology without having to pay a deposit, so no money down. And no other company is willing to do this except Roar Aesthetics, but Roar Aesthetics is willing to rebate you 100% of your lease payments for the first year. So I want to tell you how that works. The first program I'm going to tell you about 2 programs, but the first one's for the Pixel 8, and this is based on a 60-month lease. So you buy the system for $39,995. You do not have to pay any money down at all. No money down. The monthly payment on a 60-month lease is approximately $780 a month. That includes interest and principal. This isn't just where we're paying interest only. We're paying interest and principal. So if you take $780 per month and multiply it times 12, which is over 12 months, the total comes out to be $9,360. So what happens is the leasing company pays Roar the $39,995, and within 48 hours, Roar's going to rebate, after we're paid, Roar's going to rebate you your entire first year payment, $9,360. Now, we don't police you and tell you have to use that money for your payment, because to be quite honest with you, I think instead of charging $800 to $1,000 for the treatment, if you charge $400 to $500 per treatment, patients are going to pay that to have this procedure done. I think if you do 2 patients a month, you'll easily make your lease payment, and you can use that other $9,360 for whatever you want to use it for. And something else about the lease is we're making your payments for the first 12 months. After 12 months, you're not locked into that lease for 60 months unless you want to be. You can pay that lease off after 12 months and not incur any more interest, or you can just keep paying the payments. It's optional. It's totally up to you. The next program I want to tell you about is the Spectrum Pico Laser Body Sculpt program. And many of y'all may already have the Spectrum. That was our first product that we introduced. But here's how this one works. And it's a little different, and I think it's a really attractive offer. First of all, the Spectrum's a 4-in-1. It includes 4 lasers and an IPL in one system. So you have a erbium YAG laser for skin resurfacing. You have a Q-switch YAG, Q-switch KTP for tattoo removal. You have long pulse YAG for treating vascular lesions. You have an 810 diode for treating hair removal on all skin types. And you also have an IPL for acne, for matted telangiectasia, and for pigmentation. Our Pico laser, it's a 450 nanosecond, 450 picosecond laser system that is great for tattoo removal, but it's even more incredible for treating melasma and for tightening pores and a no downtime resurfacing procedure. And then our Body Sculpt is one of our newer systems. This is for body contouring. This one basically melts fat in the abdomen, the thighs, the flanks, and we have a new handpiece even for the chin. So those systems all sell for $59,995. And it's kind of the same way we were talking about the 60-month lease through Ascendium Capital. There's no down payment required. Okay, again, you don't have to pay any money down. The monthly payment on that is $1,200 a month, which equates to $14,400 a year. Okay, again, Roar's going to rebate that to you, but here's where things get a little bit different. Okay, if you buy a Spectrum, a Body Sculpt, or a Pico laser, we're going to give you the Pixelate RF for free. It's yours. You get, that's a $40,000 device we're going to give you for free. So you couple that, the $59,995, and you're getting 14.4 back. It comes out to be 45.6, and you're going to get one of those devices plus the Pixelate for free. Okay. If you need additional working capital, we've worked things out with the Premium Capital, where the free Pixelate that you received, if you want to put that up for collateral, Ascenium will set up a separate lease for you. The payment's about $800 a month, and they'll give you an additional $40,000 worth of working capital. They'll give that back to you. So basically, you couple that with the 14.4 that we're giving you, and you can get $54,400 back, rebated back to you. It's an incredible offer. And like I said, is Roar Aesthetics making a lot of money off this package? Absolutely not. But it's not about Roar Aesthetics right now. It's about how do we help the doctor gain cutting edge technology without having to pay anything down, not have to make a payment for a year, and help you out with working capital all at the same time. I think we've come up with a pretty good plan. And again, I want to thank all y'all for participating tonight. I would love to answer any questions that you may have. And again, Dr. Waldman, Rita, Madison, Chuck, I appreciate your time tonight as well.
Can I get this deal? But I said, Mark, can I get this deal?
Okay,
I'll
that's
give you
me
my
now.
unit back, and then I put that for you.
Yeah, absolutely. You get this deal, Dr. Waldman.
You know what?
'Cause
That's
a
incredible.
better deal I've ever given you.
I know it's a better deal than I've ever got.
It is.
So that's an incredible deal for sure.
Well, like I said, now it's time.
Anybody have it?
I want to do what I can to help out. So, does anybody have any questions for me or for Dr. Waldman? Okay, I would like to take just 5 minutes to turn this over to Chuck Adams for the last few minutes. Chuck's with Bell Media, and they've helped us put this whole webinar together. So, Chuck, I'm going to let you have a few minutes to talk to the group.
Yeah, thanks, Mark. I'll be really brief. You know, we've worked with Mark for a while now. You know, our company, Bell Healthcare Marketing, really focuses in on helping aesthetic providers all over the country grow revenue and drive patient acquisition. So we've put together, in conjunction with what Mark is doing from a practice recovery standpoint, really a frictionless kickstart marketing program to really help you launch any of the devices that you acquire from Roar. So there are a couple of different options that really are designed to give you the opportunity really to come out of the gate and take advantage of some pent-up demand. So we'd be happy to discuss those programs. I know that we're right up against our time, and everybody probably wants to go have dinner. But we really appreciate the time. We appreciate everybody's engagement, and certainly we're available to talk about marketing and helping you guys roll these out to your patients. So we really do appreciate it.
Okay, and one more quick minute before we go. You can visit our website. And Chuck, can you go back to the slide that shows our contact information? I'm going to give it to you, but there's our contact information. Please feel free to give us a call at 205-940-2200. Visit our Roar Aesthetics website at roaraesthetics.com. There's a testimonial page from several doctors who have our products. If you have any questions at all, if there's anything we can do to help you, we're more than happy to do so. And again, I hope you and your family are all safe, and I look forward to working with you and assisting you any way I can in the future.
Mark, can I say one more thing closing out?
All right.
Mark, can you hear me?
Yeah, go ahead, Dr. Waldman.
You know, I just want to say to everyone that I've had a long relationship with first Sandstone and then Elman. You can go back further with Elman and Roar Aesthetics, but you know, and really, I don't really have that same type of relationship with other companies. But Mark's company, you know, is a company that really follows up, and when they say that they're going to do something, they really do it. And so when something breaks down, they're the first people to, you know, to come and do whatever is needed to get you back in business. And so I can't say enough about the company. And you know, Mark, it's some amazing deals you were throwing out there tonight. I'm not really sure how you can afford to do that. And certainly not the deals that I've gotten before. We'll talk later. I need one of those deals as well.
Thank you, everyone, for joining us tonight. Again, Roar Aesthetics, thank you. Dr. Waldman, thank you so much. And Bell Media. I hope this was worth everyone's time.
Everybody be safe and everyone be safe and healthy.
That's right.
And let's get back to work in our